And then if we walk all the way out down here, if we go medial, we're going to find the sternoclavicular joint, so the clavicle articulating with the sternum. Again, you're going to get a big notch on the end of the clavicle, and this is what you can see on a lot of people, especially skinnier women. You can see this one popping out a lot. If you hit the flat bone, that means you went too far, so backtrack a little bit. There should be a little bit of a depression on some people there's not. That's why I want you to palpate on each other and on different people so that you can differentiate what those feel like. Again, we get a little bit of movement in this joint. When we abduct the shoulder, the clavicle will compensate here a little bit, but it does not have very many degrees of motion. And then we're going to come inside the shoulder and find the coracoid process. So this one you want to find the end of the clavicle. We're going to be up top on the lateral end of the clavicle here, and we're going to work our way down. So you want to slide inferiorly off the clavicle. It'll be about an inch, maybe half an inch, depending on your patient. You'll hit some soft tissue in the middle first, and then as you're walking your fingers down, you'll come across another bony notch, and this comes off the scapula. This notch is our coracoid process, and this is where a lot of muscles will attach. Our biceps attaches here, and there's a lot of movement that comes from here, even though it's a stationary landmark. So you want to locate the tip of the coracoid by compressing your fingers into the tissue. You will have to push a little bit harder, but don't push too hard, because this one is very sensitive on most people. A lot of people get sore here very easily, so if you're just cranking in there, they're not going to like it. This one is easier if you use your thumb, so in this case it's appropriate to use your thumb to palpate more. And then we're going to come down the shaft of the humerus, and we're going to look for the deltoid tuberosity. So your patient is seated or laying on their back. You'll locate the acromion on top, and then you're going to walk your way down the lateral aspect of the arm. This one's one of the harder ones to find because all we're looking for is where the muscle will attach. Your guide will be halfway between the shoulder and the elbow. You're not going to feel a huge depression. There will be a little bit of a tuberosity there, which means a little bit of a bony notch that you're looking for. So on this model, it's about right here. So do the best to find it on your partners. If someone does find a really prominent one, have other people palpate as well so they can feel it. But on most people, it won't be as noticeable. Does anybody have any questions about those ones and that trail that we just went through? All right, let's get back into our groups. So our learning task here, back into your groups, find words to describe the landmarks that you're looking for. This is a list of all the ones that you should know after that portion. So if you need to go back and look at something else again, you can. Again, I want you to think of 3 ways where palpation skills can be used within exercise science. And then when we're done palpating these ones, we'll come together as a group and talk about why this is important for you guys. All right, so go back into your groups and I'll be walking around. No, this one you can be laying down or seated. What do you think you found?
AC.
Something? Yep, so you have the acromion coming out there. And right in there. Good job. You can, yeah. because then like actually the deltoid would come this way.
So you're fine,
So we can do it that way, but if we're just going between elbow and shoulder, halfway is usually what we go off of. This one's not at, you can't use the tendons as much as you can as the ones up here, but that was a good idea to start with that.
And deltoid too,
There you go.
Does the other one feel the same? Check and see if this one feels the same.
You guys doing okay?
Yeah, just like see if everything's in the right spot. Check the AC joint.
Your right arm up.
It's like,
Yeah, it's like
right there. Did you find it?
It's swollen.
See how it's not very
It's
comfortable?
swollen, it's just harder than mine.
Yeah.
It's still there.
Oh, I thought the first time.
Yeah. This is the most recent, so it's
You guys doing okay?
but it's like in the right spot. It's like an X.
Yeah, no,
It's out of whack. And I can move it, so it's then do teeth.
Just taking an arm was. I think you're on it.
Find it?
Wait, can you help us find the concrete platform of it? It's like,
So sit. So we're gonna come down. Right. You feel that? It's right under my thumb right there. Feel that's kind of like a ball.
Now I go more. I go a little
See how it
heavier.
feels on you? You can
Yeah.
help guide too. That they're getting closer.
A little bit nice. Keep a little. Keep it like this. Yeah, how much you're supposed to.
Did you get a chance to palpate? No.
Say I go like this, and you're supposed to like keep your thumbs up. Not like, no. Like if you're going like this, like you also say like you go like this, you like anterior rotate your shoulders, and you're like have a little bit of weight.
Whoa, that's really extra. Whoa, this is
I fell asleep here. Because they have like, I was laying there, they have like the sky. Like, they have like clouds and stuff, and I was just looking, and then from like the clicking sound, it just like soothed me. I fell asleep there. It's a tube, it's, they had to like inject, they died, like into the labor, like deep.
very thorough massage. Deep massage. I can find it. I think that's it.
That's okay. That one's gonna be the more difficult one to find.
so I'll be watching. I don't know if
Like I wonder what you're doing with blood pressure. My arms are like
All right. So through palpation, it should help you guys be able to actually feel and see and be able to apply the skills that we're learning. In your grade groups, what kinds of things did you come up with for why this might be important? What was that?
Like dislocation.
Dislocations. If you witness like an injury or something like that, you can kind of differentiate what structures you can see and what structures you can feel to figure out what might be dislocated.
When you're trying to like find certain muscles if they're torn or whatnot in the shoulder, knowing where the bones are, they're big landmarks.
Yep, so knowing these bony landmarks and where muscles attach will give us a good idea if something's torn. She said that we can differentiate between what muscle that might be.
And to kind of like evaluate like before you do anything, just to not see if there's any.
Yep, and then going along with that, she said evaluating to find pain. What we're going to do is palpate on each side. So then if we're dealing with an injured person, we would palpate on one side that's not injured and compare it to the other side, and then we can find what those differences might be.
Yeah, that's what I was gonna say, cause Nate, on his one side, it was fine, like I felt everything perfect, but then on the other side, I felt like a little bit of swelling, and he told me that he dislocated his shoulder the other day.
That's a great, the other day.
Actually.
That's a good example, you know, he was able to find something and now he knows what that will feel like, so that's why it's important to feel what's normal and to compare it to what's not. So now that's a skill that he has and he can keep that with him for future reference. All right, does anybody have questions overall for palpation?
So what are like the most major reasons for palpation?
Main things would be comparing bilaterally, so knowing what normal feels like and if we're looking for something to be wrong. What we're going to go into next is range of motion. So if we know where all of these bones are and what those landmarks are, we can associate it with the muscles that attach to it, like Madeline was talking about. And then it makes it easier for us to understand the whole shoulder as a concept and how it's working the way it works, if we can break it down into all of those levels. All right, so going into range of motion. So range of motion in general is the patient's ability to move through its available range of motion. So this means the shoulder's freedom to move in the 6 ways that it can. And what we're evaluating is what's normal for them, and then the angle at each joint and how far they can go. Reasons that a person might not have full range of motion could be related to injury. They could just be inflexible in general, and that's how they are. They could have a sedentary lifestyle, so they're not very active, which means that their body is not being pushed enough, and so then they don't have that full range of motion anymore. And then if they fail to rehabilitate after an injury or a surgery, they might not get that range of motion back. And so it's something you really have to push and be active with to keep up all the time. Today what we're going to go through is active range of motion, and what that means is the degree of movement that a patient can produce using his or her own strength. So if I were to stand here right now, I can lift my arms this high. This is my active range of motion. If I were to come over to Josh and move his arm for him, that's passive range of motion. So today we're just going to do active. We're going to learn how to measure a person's range of motion in their shoulder and their ability to go through that range of motion. During range of motion, a barrier can also impede the extent of joint movement. So why my head can't go all the way around is because there are barriers there that protect it and that make sure that it can't go farther than it should. In a healthy joint, there's 3 types of barriers. The first one is bony, which would be restriction where bone meets bone. This occurs during jaw elevation and elbow extension. So my elbow only goes this far because my radius and ulna are hitting on my humerus. And that's an adaptation our body has, and that's why it can't go all the way. If it went farther than this, all of these muscles up here would tear, and it would be bad for my whole arm. The next one is a tissue end feel, so when flesh comes against flesh. This happens at the end of hip, knee, and elbow flexion. So again, in the elbow, if I were to come all the way this way, I can't come all the way here because my muscles and my flesh are hitting here. So in some people this will be more than others. depending on how much muscle mass they have or how much soft tissue is there. But this is a tissue end feel because it's hitting on each other. The last one is an elastic limit of a joint or a ligamentous end feel. The most common occurs in the knee, and so if we were to feel the cruciate ligaments, that means that those ligaments are protecting the knee from going in ways that it shouldn't. So when you're palpating, I want you to think, or when you're palpating and doing range of motion, I want you to think about these end feels. A bony end feel obviously will feel hard and it won't go any farther, and there's really no give to it at all. A soft tissue end feel will be kind of squishy or elastic, and sometimes you can squish it to go a little bit more, but it's still going to have an end feel. And then the ligamentous end feel is going to be spongy. So we're not doing the knee today, so that might not be one that we feel, but just think about that, what those ligaments would feel like. So these are some muscles that we're going to go over today. I don't expect you to know all of them, but these are the muscles that are doing the motions that we're talking about, so I just thought it was important for you guys to see them. We can come back to these also if you need to. So this is a side view. This one here is deltoid, so the tuberosity that we were palpating is going to be right here in the middle, and that's where the deltoid inserts onto the humerus. And then these are on the back side, so we have deltoid again, trapezius up on the top, that's what we were palpating in here. So then when we were feeling around clavicle and spine of the scapula, we were going over trapezius. All right, so the shoulder has 6 ranges of motion. Today we're going to measure 5. Here I've listed the muscles that go with each motion. I don't expect you to know those